Welcome to the Fat Emperor podcast. I'm your host, Ivor Cummins. Welcome back, guys. It's November the 2nd, and we're going to be discussing the viral issue again today in some detail, so it's going to be fascinating. I have a doctor, an MD, Reid Sheftall, and not only is he a doctor, but he scored 99.95 percentile on the SAT scores, right? That's 1580 out of 1600 max. So that's extraordinary. He's also been done physics at MIT, and he also got 99% in both the medical school boards exams and the surgery boards. So we're talking someone way out there, right, in the next plane. So this content is going to be very accurate and very insightful. So great to meet you finally, Reid.
Same here, Ivor. Thank you.
Not at all. And I think we'll go straight into kind of slideshow mode because a lot of these concepts, it really helps with the visuals, and you've done some great slides. So I'd say roll ahead from the start, and I'll interject here and there maybe if I have something useful to say.
Great, Ivor. Thank you. Can I just say one thing at the beginning? We're going to be talking about statistics and graphs and patients, some of whom have unfortunately passed away from this. And I just want to make sure that as we talk about the technical and the mathematical part, which can sound kind of cold sometimes, I don't want the people that view the video to think that we don't feel every single patient who's died here. And you would agree with that, wouldn't you?
Oh, absolutely, Reid, and it's a great thing to clarify up front. So I often have to remind people when I'm going through the data in a cold clinical way, the only way to crisis manage is to look at the data without too much emotion. You must do it on behalf of the health of the nations. So my mother's 80, she's obviously been greatly exposed to this. I always say my motivation, what drives me in sharing all of this data and a proper perspective is I have 5 children, and I'm interested in the future of the next generation, and I'm interested in truth in science. So our motivations, absolutely, Reid, are bang on, perfect, and we care. But we must be honest about the science as also.
I agree completely. And I wanted to say this also, as we talk about the data and the mistakes that were made, frankly, and why we think they made mistakes, what we're really doing, we're not being cold-hearted. We're trying to improve society so that we don't make these mistakes again. And in that way, we will save lives from all this mathematical talk.
Absolutely, Reid. And with that, I'm going to enjoy this now.
Me too. Thank you very much for having me. I'm going to explain this in a second, but I've had to limit my discussion of these topics to Facebook because I tried to get on a more national forum and I did not receive any answer. Early on, I'm talking about in March, when I thought about a lot of this stuff and came up with a different way of looking at it, which I'll explain. So I feel really honored to be with you, and I appreciate it very much. And this is an international chance for me to explain some of my ideas, and I thank you very much.
Not at all, Reid. It's a pleasure. And, getting the message out there is what I'm all about. Accuracy in science. So thank you.
Same here. Thank you. Okay, the first slide is a quote by Dr. Richard Feynman, who is a Nobel laureate in physics. And I'd like to read it if you don't mind. It's so germane to the whole issue of what we'll be talking about today. First, you guess. If it disagrees with experience, the guess is wrong. In that simple statement is the key to science. It doesn't matter how beautiful your guess is, or how smart you are, or what your name is. If it disagrees with experience, it's wrong. That's all there is to it.
Absolutely. And it's so salient to this because there were guesses and modeling at the start, and then empirical data began to come in. And that's when I got really engaged because it seemed the world is trapped in a time warp of the early modeling and not following this basic rule.
Thank you. Absolutely. So let's proceed on now. Okay, this is an electron micrograph of the virus that we're going to be talking about today. And the virus is only 100 nanometers in diameter, which is smaller by 1/4 than the shortest wavelength that we can see in the visible spectrum. So these have been colorized. They usually show up black and white because of the transducer when you do an electron micrograph, but these are colorized to make it easier to see. And this just shows the electromagnetic spectrum and how small the visible light spectrum is. The virus would be over here somewhere. Now, I mentioned already that I have been using Facebook to write essays, really very long, people were nice enough to read them, about different aspects of the, not only of the virus, but also the policies that were enacted because of the mistakes that were made early on. And I'm not going to read all these, but because we'll introduce each one through the talk. But you can see that many of the claims that I made and the corrections of the experts occurred in mid-March, and I was alone. It's funny, I thought back on the climate change issue with 97% of scientists, quote unquote, agreeing on things, and I was thinking, boy, they were lucky they only had 97% going against them, because at first I had 99% going against, or more than 99%. I was the only one talking about this stuff at first. Early on, infection mortality rate claims varied from 2.7% up to even 7%. Most were in the 4% range, which is about 40 times too high, which is very, very important because it caused panic and fear in the public. When you started multiplying 4%, for example, times the population of Ireland or the United States or Switzerland, you came up with an awful lot of deaths, and it really scared the public. Let me just say a little bit about how I figured out that the infection fatality rate was wrong. This was back at the very beginning, and what I did was I noticed, as a surgeon, we noticed that surgical outcomes are very close. From a very good surgeon to a very mediocre surgeon, the mortality and morbidity is very close. Yet when I heard the information about what had happened in Italy, where 7% supposedly of the people infected were dying, and in Germany where it was much lower, I'm thinking that doesn't make sense, because the Italians would call their German colleagues and find out if something was being done differently and change something, and the rate should be very close to the same. So I knew there was a problem. And I'm in Phnom Penh, Cambodia, so I had access to no information, but I started thinking about it mathematically. And what I came up with was the idea that they were using selection bias in their counting of cases. And so what I did was I looked really hard to find a place where everyone had been counted and calculated the infection fatality rate from that. So with a pencil and a half a piece of notebook paper, I found some information on a cruise ship back then where everyone had been tested, and a small town, I think it was in Germany, where the whole town had been tested for some reason. And when I crunched the numbers, the infection fatality rate came out to 0.14%. So I knew there were some gross errors going on with the way that the cases were being counted by all of the important organizations that I just listed. What resulted from that was I didn't really get any footing, because I posted it on Facebook and everybody said I was crazy and wrong, and wrote letters to Fox and CNN, hoping that I could come on as a guest for 5 minutes and explain this, but I didn't hear back from anyone. So anyway, let's put that aside for a second and talk about the problems that can happen when you make a mistake in the infection fatality rate that's that severe. What happened, unfortunately, is that everybody accepted those numbers as gospel, if you will, and proceeded to make models that were way off. Epidemiologists appeared on television and they were way off. The general population, as I said before, began to panic. And then the politicians were able to, and I'm not saying they were nefarious in this, but they were able to institute some policies which were extremely destructive, and we'll talk about that in a second, I don't think the general public would have agreed to lockdowns, for example, if they had known that the infection fatality rate is 0.1%. Okay, it's the same as flu. And the data has now proven me correct on that. So let me proceed on. But this is what happened. It was like a cascade of events that took a mistake at the beginning and passed it through all of these very intelligent, conscientious bodies, if you will, and it resulted in some terrible policies. We'll talk about that in a second. This is sort of my way of making a visual representation of what I just talked about. China thought the infection fatality rate was 4%. The WHO kind of echoed that. Experts in the United States also echoed it, and it got all the way down to where I was debating people on Facebook and the internet who had no scientific background that I was wrong and why I was wrong and so forth. It got to be a little bit ridiculous, but that's the price of coming up with something that's 1/40th of what the experts say. I was contradicting the experts. Now here, as of September 10th, is a slide that shows what the survival rates are by age for various ages. It's an old person's disease primarily, which we'll talk about that and the reasons for that. But this was on September 10th. And I'd just like to point out that the CDC, which published these numbers, was one of the organizations that had it at 4% early on. These numbers translate into a 0.1% infection fatality rate. So what is the survival rate between age 5 and 17? I actually cannot find it, but I did find on the CDC website, on the Morbidity and Mortality Weekly Report, that 51 school-age children have died of COVID-19 so far, as of from March 1st to September 19th. Now, there are 56.4 million students in elementary, middle, and high school in the United States. So that means the chances by population, not by infection, but by population, are less than 1 in a million per year for a student in school. And that's very important because we've shut down the schools in America, which causes a lot of problems, which I'll get to, excuse me. When I started thinking about this, I wrote a post again that talked about why shutting down schools makes absolutely no sense. Every year, more than 200 school-age children on average die from the flu during a 5-month flu season, okay? And in 2017, 2018, which was a very bad flu season, estimates were that 650 died, okay? We've already said that in 10 months this year, 51 children have died. The other issue is flu causes much more morbidity than SARS-2 in that age group. By morbidity, I mean things like everyone that gets the flu goes to bed, they're tired, they get fevers. Sometimes they can even get septic from it. I've had to drain lung abscesses from patients who started out with the flu. So it can get very serious, the morbidity now, not the mortality. So if you want to be consistent, if you want to say it that way, if you're going to close the schools for SARS-2, you must close them every year for the flu because it's actually much more severe in the school age group, okay? Now, another issue that's a problem for closing schools is that schools actually discover things that aren't discovered at home because it's the first time that people sit in a class and have to hear things well. And maybe if they're sitting in the back, they can't see the blackboard. I was real nearsighted when I was young. I couldn't see the blackboard very well. So if you shut down the schools, you lose the chance to discover those children who might need glasses or have hearing problems, or even were abused at home. Sometimes that's discovered at school. So there's more things involved in closing schools than would first come to mind. And internet teaching, it has a few problems associated with it too. One of them is that the kids don't really log in too much. They did a survey in Boston and only half the children were logging in. And the other thing is some children don't have enough money to own a computer. Now, I just talked about closing schools. I want to say this with all due respect to everyone who's not a doctor out there, but a little bit of medical perspective goes a long way when you're talking about diseases that apply to a very large population. And what I mean by that is there's a saying in law, and the lawyers will recognize this, that says hard cases make bad law. I remember fairly early on, there was a Kawasaki-like syndrome that was publicized a lot in the United States because 5 or so children got this Kawasaki-like syndrome, and that scared the parents in the entire country. I was talking about 56.1 million children. It scared the parents because Kawasaki-like syndrome is pretty serious. But it was only in a few patients, and they used it. The people that were in favor of closing the schools, and there are a lot of them, sadly, in my opinion, used that as a reason to keep the schools closed. So hard cases make bad law, okay? The other thing I wanted to talk about as far as medical perspective is testing healthy people, and maybe Ivor, you could comment on this. In 2017, 2018, which I mentioned before, between 70 and 80 million people in America got the flu, okay? Nobody noticed for the most part, and no one was tested. I'm a doctor, and I vaguely remember that it was a bad flu season. That was it. And yet with COVID, we're testing so many people you wouldn't believe it. I'll show you some graphs later that show you how many people, asymptomatic people now, are being tested per day, and what it might cost when that money could be used for a more productive purpose. Do you have any feelings on that, Ivor?
Yeah, actually, Reid, this has come up with an Irish doctors group as well, that it's kind of unethical and it's against good practice. So testing asymptomatics at a massive rate, you know, the whole basis of medicine is people with symptoms to test them, verify, you know, what's going on, treat them accordingly. But now there's enormous testing, and it's beyond belief. And just from the European data, to look at 2017-18 season, there were around 140,000 excess deaths in the respiratory season. And this year, there's around 185,000. So you could say around 35% worse for mortality, SARS-CoV-2, than 2018 season. But no one wants to look at that data. It's hard to, I don't know, it's hard to articulate how bizarre this has become, yeah.
Yeah, it's hard to fathom it. I mean, it's like, well, I think there's factions in society that are pushing this to be a big problem, perhaps because of the election in America. I don't want to talk about politics, certainly at first here, but there are groups that don't seem to be looking at reality very well. And that's something philosophically that bothers me. You know, I see more and more of that as I get older, and not just in America, but in the whole world. It's like we're moving away from science in a strange way, but those same people say, you've got to follow the science when I say something like the infection fatality rate is only 0.1%, as if I'm not following the science as an MIT physics guy and a doctor. It's amazing. Okay, let me continue on. Another problem with the test, by the way, is it's performed, a test called the PCR test is used, which stands for polymerase chain reaction. And there's a lot of problems with that test, which I will talk about later, I think. But let me just say up front that when we see all these positive cases, some of them are older than they're letting on. They're calling them new cases. The test looks for messenger RNA fragments in the oral pharynx, okay? It's a swab test. It's an antigen test, okay, as opposed to an antibody test. And those fragments can stay in there for months after the patient has recovered. That's number one. And number two, think of the name, it's polymerase chain reaction. The PCR test is an amplification test. It can take a tiny fragment and amplify it into 1 billion fragments. And someone when we talk about immunology in a few slides here, I'm going to explain that there are different types of immunological responses to a pathogen, one of which is the barrier immunity. And you can have fragments of messenger RNA in your oral pharynx and have never gotten sick from the disease, never even registered on the scale, no blip, no signal, no nothing, because the barrier immunity injured the viruses early on and broke them into pieces, and then the PCR picks it up as a new test. Just something I wanted to add about that. Let me continue on quickly. Now, here's another problem I have, and I don't want to spend a lot of time with this because I'm probably talking too much already, and I'll speed it up. I read 2 quotes from the Mayo Clinic. One said that studies suggest that the majority of patients develop antibody response in the 2nd week after onset of symptoms. And the other said symptoms begin 5 to 14 days after infection. And I drew a graph, or I copied a graph, and then I put those 2 statements onto the graph. And there's really no reason to test asymptomatic people. That's the bottom line. I can show you why, based on this graph, why the graph, now this is assuming the statements are correct and the graph is correct. And I got them from very credible sources, such as the Mayo Clinic. But if I can just spend 30 seconds on this, and then people that really want to understand this can go back and look at it, but I have to introduce you to the concept here. It says patients develop antibody response in the 2nd week after the onset of symptoms. So if you look at the blue curve here, that's the IgM response. Oops, little mistake there. That's the IgM response of the patient in the graph, okay? Or the group of patients. And yes, the infection, the symptoms occurred here, right here on this line, and the antibody started in the 2nd week, as pictured. But it also says the patients develop antibody response, or symptoms begin 5 to 14 days after infection. So I just went backwards on this, wrote in when the infection would have had to have been for the symptoms to start on the 5th day, according to the blue line. And again, the arrow's blue and the line is blue, okay? And on the 14th day, which is a green arrow, so I drew this green arrow in so that it would correspond correctly to the first sentence, which says patients develop antibody response in the 2nd week. So anyone that wants to look at this, go back and look at it. But up here it says most infectious here and infectious here. And they're testing people before they had the onset of symptoms, before the box here. And they're not infectious until much later. So I just wanted to point that out. It's inconsistent with what people are saying on television. Sorry for being so wordy there. This is Dr. Feynman's quote again. We're going to talk about lockdowns now. I won't read it again, but remember, if it disagrees with experience, it's wrong. So we're going to show some evidence now that lockdowns not only did not work, but they caused much more death and destruction than if they had not been instituted. And I made this post on March 17th before, in America anyway, we'd even started a lockdown. Let me just say this quickly. The experts are still recommending lockdowns in October and now in November. And Ivor, I'd like you to comment on that. I heard that Boris Johnson has decided to put a lockdown in place. Has the French authorities also done that? Have they done that? And what's going on in Ireland?
Yeah, well, Reid, it's extraordinary. So Ireland went to a level 3 lockdown, which is, plenty strong, many weeks ago. Our infection positivity rate and hospitalization had leveled off recently, and they went to a level 5 lockdown, kind of a stay-at-home, 5-kilometer limit, full lockdown for 6 weeks, which is devastating to the community, society, economy, and everything else. And it happened after things had leveled off. In Ireland, our ICU, we have 40 odd people out of 5 million in ICU with SARS-CoV-2, and they're not necessarily all driven by COVID. and our hospitalizations are not unusual for this time of year at all. And again, many COVID cases, hospitalizations, are other issues. I have people on the inside. A huge amount are other issues, but they happen to have a positive test because in the winter, the coronaviruses rise in prevalence. So we have this bizarre situation that's as anti-scientific as is possible to get. And you're absolutely right. France has now gone a similar route. UK is planning on Thursday to go into a full country lockdown. And if you look at the mortality curves for 2020 right up to October 20th versus prior years, there is effectively nothing going on. So I think a huge amount of those coronavirus deaths or COVID-19 are deaths that would have happened anyway for influenzas or many myriad other issues. But they're going into full lockdown for the full country. And 80% of the country has less than 10% hospital bed occupancy with SARS-CoV-2, and they're locking down the whole country. And the final thing I'd say is, Reid, it's based on, again, what happened in March, April, to your earlier point. It's based on modelling. So they're not looking at the empirical data. They're looking at a seasonal rise in hospitalizations, respiratory. They're getting a lot of positive tests, and they're modelling it forward as if it was a novel virus again. Even though we've got community immunity, the impacts are way lower. We've been through the Gompertz curve, the big impact that comes with a new virus. And seasonally, we're seeing probably the normal stuff and maybe a little bit more. But they're modelling it to death rates higher than the initial epidemic last March, April. I'm not joking. Whitty, Valence and Boris on television showed modelling of death rates much higher than the actual epidemic back in March, April in the UK. And here we go again. It's shocking.
Well, you've stolen my thunder a little bit because I was going to talk about all of that. And it is amazing. People are ignoring science. They're not looking at, it's not just some foreign doctor in Phnom Penh now saying that the infection fatality rate, they have it all wrong and so forth. The data is in now. What I really upsets me is that they're going to go in and do it again after some of the numbers that I get ready to show you. And let me show you a few of them. Okay. The lockdowns caused so much death and destruction and will in the future. Let me just list a little bit. When you lose your job, like happened to so many people, you lose your medical insurance. Some people lost their life savings. Some people will lose their life. And I don't mean some, I mean millions. And I'll talk about that in a second. The lockdowns did not really do anything helpful either. They didn't reduce the mortality and they did not flatten the curves. And I'm going to prove that in just a second. The other issue with when the proof begins to start, I'll show you that the people that use lockdowns have indistinguishable graphs from their neighbors, okay? Let's start with, I believe this is the UK, yes, it's NHS England data. It talks about when the lockdown was initiated and when there was a partial lifting. And I'd like to ask your opinion on this, Ivor. When you initiate a lockdown, you expect to see some changes. How many days after you initiate the lockdown?
Well, you'd expect. I mean, the classic was 21 to 23 days between infection to death. So certainly 20 days later, you'd expect to see the mortality curve shift. But earlier than that, you'd see the infections shift and you'd see the hospitalizations. And a great example, just to throw in, because I got pulled the data yesterday, is Florida. And Florida in America, they've obviously got metabolic health issues and they were hit pretty hard. But it's actually 37 days ago that the governor, on the inputs from Professor Michael Levitt, Nobel Prize winner, who assured him of what you're saying, the governor dropped all lockdown measures and all mask mandates and fines. And Florida opened up 35 days ago. And the mortality curve went on as if nothing happened right up to today. So the empirical proof of this is astounding, but I'll let you get back to this one. I like the UK one as a great example.
It really is. I'm glad you mentioned Dr. Levitt, because he's a very measured voice in a lot of this. You may agree with that. And I want to give him and Dr. Ioannidis, also of Stanford, some credit. When I came up with the idea that there was selection bias in counting cases and that the infection mortality rate was really equal to the flu, just a few weeks after that, Dr. Ioannidis published something on YouTube, which was saying the same thing. And I'll tell you, it was a relief, because you would not believe the emails and comments I was getting. It was getting very personal about me saying this stuff, like I'm a child killer and all this kind of stuff, because I was talking about no need to close down the schools, etc. And then when these very distinguished gentlemen, Dr. Levitt is a Nobel Prize winner, as you know, said basically the same thing that I said, I felt like, well, I'm in good company anyway. I'm still arguing with people over it.
Well, I think actually, Reid, people don't realize the Great Barrington Declaration now, there's 40,000 doctor and scientist signatures and over 500,000 lay people. And like, there's Professor Levitt, there's Professor Ioannidis, there's Professor Gupta from Oxford, there's Professor Carl Hennigan, head of the Centre of Evidence-Based Medicine in Oxford. There's Professor John Lee, Carol Sikora, professor. I could go on and on and on, but there's a massive number of professionals across all fields. Professor Beda Stadler, immunologist, the vaccine pope of Europe, the Fauci of Switzerland. I went there to interview him. Same thing. There's a vast number of absolutely correct professors saying what we're saying. But unfortunately, the media will not cover them because the narrative now seems to be set in stone, and it's anti-scientific, and it has been since around May, when the Gompertz curve fell in Europe, and the empirical data clearly showed in many, many analyses that lockdown did not correlate to improved mortality outcomes worth a damn. There are so many publications, and no publications, credible ones, to suggest empirically that lockdowns did give a mortality benefit. So all of the science now is clear as day, and no one will cover it.
Isn't that amazing? I mean, we could talk a lot about science journalism, if you will, but we'll get off the beaten track a little. I need to move forward here, but I would like to talk about that closer to the end of the talk. But just to go back to this English graph, I mean, I can't see any hitch in this graph whatsoever that corresponds to 20, 23 days, 21 days, 27 days, any number of days after the lockdown was initiated or after partial lifting was put in place. If you partially lift the lockdown that supposedly was reducing everything, things should increase, but none of that happened. So here's one example of virtually every country we could look at. And then strangely, they instituted mandatory masks in shops, I think it was, at the end of July. I can't figure out what the reasoning behind that was, but let me move on. We can talk about that when I talk about masks. What I wanted to say about all the doctors that are seeing the light now, if you will, as far as looking at the data honestly and mathematically, when I put these initial posts out there, I couldn't find anybody that was doing this. Is in mid-March, but everyone now, certainly there's a lot of very credible people talking about this. I'm going to go through a bunch of countries here, and you're going to look at the Gompart curves, and they're going to all be about the same without any distinguishable changes in the curves. Argentina, El Salvador, was that Colombia? Yes. Here are the death curves. Those were cases. Here are deaths. And this corner down here is Sweden, which we all know, and we'll talk about it in a second, did not institute lockdowns. And their curve is qualitatively the same as all the other countries listed here: Spain, United Kingdom, France, Italy, etc.
Sweden, yeah, is the perfect example. And then you hear the anti-scientists claiming Sweden practiced natural social distancing. Uh, but that's all false as well and anti-scientific because CNN went into Stockholm on the 6th of May. That was just after the hump of the epidemic. And they videoed elderly people even getting their hair cut, no masks, hairdresser snipping all around, chatting with them, cafes, all the people in there. They just said stay 1 meter distance, hand washing, symptomatic stay at home. And Stockholm had all of this activity right through. Though, in fairness, in April, in late March and early April, because of the fear that you described earlier of this enormous fatality rate, uh, things in Sweden around end of March and April, I was told by a doctor there, everyone did kind of go, whoa, and they stayed back. But then by mid-April, when it became clear what you described, the fatality rate, and it was more an elderly disease, things flowed back to normal during April. And you see the curve never change through any of those changes, any of them. It just followed its remorseless viral path, as it always does.
Yeah, isn't that amazing? I mean, here's one more quick example of South America. Brazil did not have lockdowns at first, but according to this news release, in the Northeast, where the health system is precarious, let's say, that's their words, not mine, they did begin to institute lockdowns. That's the green arrow here on Brazil's curve, which is in green up here, and no change. Argentina, which is a country that is known to wear masks in great abundance and had a very strict lockdown, no change. And here's the real icing on the cake. Uruguay is between Argentina and Brazil. They did not institute a lockdown. Their president recommended that people stay safe if they're vulnerable, to try to stay away from sick people, that sort of advice. And look at their curve. It's flat from beginning to end. They didn't get any cases or deaths.
And I think the primary drivers now of your actual mortality curve do not include lockdown. The big ones in Europe and elsewhere are prior flu season severity. So if you had a bad season in the last 18 months, you have relatively low death for obvious reasons. And if you had relatively soft seasons, it's much higher. Population health vectors, and particularly the health of the aged and vitamin D status are big too. So there's all these drivers for a country. So Uruguay might be undercounting a little, you could accuse, but the reality is Uruguay just have different factors. Lockdown is not part of it. And the last thing I'd say, as I always say with Brazil, they identified SARS-CoV-2 in the wastewater, the human sewage, in November 2019, same as Europe. It was in community transmission. And yet you can see Brazil rises out in May, June, and Europe shot up in February, March, and April. And it just shows the seasonal driver, which is another big driver of the challenge. But again, it's not lockdown, because look at Brazil. I mean, look at Argentina would have had it in the community also, as would Uruguay, almost certainly, way back. But they seasonally rise, independent of whether you lock down or not. This is so dramatically present.
Absolutely, I agree 100%. And if you look at the graphs from South America, they're fundamentally shaped differently because the climate regions are different than North America and the Northern Hemisphere. I don't want to focus on the USA too much. I apologize for that. I know it's just as severe, if not more, in Europe, but I'm more familiar with the US data. But, people are not pointing out the really obvious scientific things and the reasons for them, which we'll get to in just a second. What you mentioned about the prior seasons, I think is an enormous factor, because in a place like Sweden, where you had 6,000 deaths and they had a very weak prior season, many people that would have succumbed in a normal season were, I hate to sound harsh here, but available to succumb to COVID when it came around. Do you see what I'm saying a little bit? we'll talk about that later. And if you have any graphs of that, could you please drop them in so the viewers could see that? Thank you. And let me continue on. Here's an interesting thing. I found this graph on one of the Oxford studies where scientists compared the number of cases in a region with how stringent the measures were by the government. And you can see that there's no reverse correlation like you would expect if the stringent measures decrease the cases. You should see a curve on a graph like this that starts in the upper left, if you will, and goes down to the right. In other words, if the measures are not stringent, you should see more cases according to their thinking. And the stringency involved degree of lockdown, group restrictions about how many people could meet, mask mandates, et cetera. And this isn't perfect correlation, but to me, there's more of a correlation going this way than this way. Do you see that? Isn't that strange? It's the exact opposite of what the people were saying.
Yeah, and you know what? Whatever about cases and testing rates, positivity and mortality, which is the hard measure, all show a similar relationship. The PANDA Pandemic Analysis Group, the actuaries out of South Africa, did a report back in May. Same thing. You see it nearly everywhere. There's a slight correlation with more severity of lockdown, more problems. And that might just be that, you know, developed countries with more metabolically ill people may be more quicker to do lockdowns. It could be anything. But the real point is, to Feynman, the empirical science, the evidence of our own eyes. And it's the same with mask introductions. If you look at around 10 or 12 countries where they brought in mask mandates, there was no impact on the curve, the R value whatsoever. So the empirical science of our own eyes is screaming at us. Masks and lockdowns don't really move the needle much, maybe a little. But no one wants to know. It's an ideology now. It's a religion. Professor Levitt said it's medieval type ideology. It is no longer science.
Exactly. That's a point that is screaming loud and clear from all this data. Nobody's presenting the data as it became known. Sure, people thought I was crazy back in March, but there's no reason to even talk about back in March anymore. The data's here. It's not speculation anymore. So yes, you brought up Dr. Feynman's quote, and it is really applicable to what happened to the world here. And there were a lot of terrible fallout from it. There was, there really was. I'm going to list it in a second, but yes, I'm talking about cases here, and I'm going to poo-poo the cases along the way, as I already have the PCR test a little bit. What matters is mortality, not cases. There are so many problems with counting cases. I'll take an hour to explain them. Would you do me a favor, though, when you get a chance, if you have data on how the R values did not change when the lockdowns were instituted, could you show the viewers that? Because I looked for it and I couldn't find it, unfortunately. I knew that would be something that would be very interesting. Could you do that, please?
I'll put in a cluster of them during this segment. So let's look now. Here's Germany, and we see mandatory masks came in, retail and public transport, back at this point. But you'll notice that the infection rates had already fallen right down, and the curve never changed one iota with this intervention. We see for Austria as well, mandatory masks, but the R curve had fallen and nothing changed afterwards, essentially. Poland, same story. Everyone required to wear masks, curve was already down, and nothing effectively changed. And if we look at Sweden with no masks and no lockdown even, the R curves, and put England in here and Germany, which we already looked at, these are the R curves from the databases. And it came right down with the standard viral pattern and has not changed, regardless.
Here's another everyday example of what we're talking about. People that stayed at home, indoors, were not out working, were the ones that got the sickest. And here we are talking about lockdowns. Governor Cuomo came on CNBC and listed the initial findings of who was getting the sickest from this. And it was people who weren't working, people who were not traveling. It was predominantly non-essential employees instead of essential employees, which is a distinction for people who have to keep working while the virus is going on and to whom the lockdowns do not apply. They were healthier than the non-essential employees who were forced to go home and stay indoors. So when you hear this sort of thing and you look at the graphs, you have to think that not only did lockdowns not do anything helpful, but they caused a lot of problems too. I'm going to show you some numbers in just a second, but this is Governor Cuomo kind of doing a mea culpa because he was in favor of all the lockdowns and he instituted them in New York. I put this information up here because I find the Sweden, Norway, Denmark, Finland area very interesting because people on both sides of the argument will use Sweden as an example. I've been debating Sweden with a few people, not doctors, not scientists, but they seem to tell me that there actually was not a lockdown mandated in Sweden, but everybody did an effective lockdown. But that's not what your experience and my experience is with looking at the video, perhaps from CNN. Is that correct? They did not have a lockdown. Even in the height of the going up a little bit, it scared them, like you mentioned, but easily into the height of it, I saw women walking arm in arm on the street in Sweden. I saw people in bars, in restaurants, no distancing really. So they didn't have a lockdown there. Would you agree with that?
Absolutely. They, like we said, in March coming into April, there was fear everywhere, and the Swedes are like anyone else, and they pulled back. But then they realized, and it dawned on them, you know, what we've been talking about. So we have the CNN footage and we have the first-hand accounts from people in Sweden. The reality is that, you know, there's one area of Sweden that's not far from Denmark, and it has the exact same mortality as a very equivalent area with a couple of million people in Denmark. It's a nice case control. Stockholm got hit, care homes got hit, Somali ethnics, which were unique to Sweden, got hit because of profoundly low vitamin D and other metabolic issues. But when you look at the data, the other thing about Sweden is, you know, we said 23 days from infection to death, roughly. Well, you can see that when Sweden began their measures like the other Nordics, but did way less or fewer measures, 23 days later, you would have got the effect of the difference in measures between Sweden and the Nordics. But 23 days later, Sweden was already way up in mortality compared to the Nordics. So we have the proof that Sweden's mortality was baked in and inevitable, independent of what measures they took relative to the Nordics.
That's a very good point. It was already in the graph.
It was in the graph because of their prior season is dramatic. They had around 4,000 fewer deaths than the normal line in the prior 18 months. And guess what? They got 5,600 deaths. So most of them were kind of the prior season. But even besides that, just to your point there a short while ago about Cuomo, I saw that Cuomo was pulling his hair out and he said, how can it be that 66% of the new infections weeks after the stay-at-home orders are from people who did stay at home? And the answer is simple, that the virome is complex and lockdowns don't work. But the other thing is, it's so obvious. In Ireland, UK, and in 4.3 million grocery workers in the US, there's one common thing. The grocery workers who are absolutely not locked down, they were 8 to 10 hours a day with the great unwashed flowing in and out, getting their essential purchases. There were no masks, right? And it's indoors. The grocery workers showed no signal for extra infection or death. And they were ultra exposed, non-locked down. They're the perfect evidence with our own eyes that the lockdown does not really impact the curve. But I kept making that point, and people who argued with me would just quietly slink away. So the cognitive bias is so powerful in the people who believe in lockdowns and masks and things that when you give them unassailable evidence of what we're saying, they actually are just forced to slink away and not answer. They still will not give up the belief system.
Exactly. In America, it got so bad that there are a few examples on YouTube of videos where hot coffee was thrown in the face of a person who was eating their food outdoors by a sidewalk by someone who was one of those mask crazies, if you will, and I don't want to be too derogatory here. She threw hot coffee in the face of a guy because he was eating and had his mask pulled down. There was another lady who sprayed mace in the face of a guy who was eating. I mean, this got to be a religion, just like you're saying, in the United States, and it still is. And the politicians are still doing this. And it upsets me greatly as a doctor who's devoted his life to trying to rescue people, save them, help them with medical problems, et cetera. I don't want to be too dramatic here, but the fallout from these lockdowns is enormous. I'm going to read it to you in just a second. I'm glad you brought up the thing about Sweden having a very weak previous year, because as you said, there were 5,600 deaths. And if they were 4,000 under the previous year and you subtract 4,000 from 5,600, you get 1,600. And when you plug those numbers, well, just do it by ratio. You're subtracting 75% roughly of their deaths, 4,000 divided by 5,600. So you see the deaths per 100,000 here that I put in, showing that Sweden did not fare as well. But I guarantee you, if you take 75% off of 58, you're going to be down in the range of Denmark easily. Yeah. Because you follow me? That's 1/5 of Denmark.
It's even better, Reid, because then you correct for the Somali, you correct for the large care homes, and you keep on cutting until you're down to the Nordics, the other, Norway and Finland. It's easy. It's crazy.
Yes, and that kind of study is the type of thing that you and I would believe in because it's reality and it's relevant, it's germane to the question. But I'll tell you, if I sent you some of the debates I have, you wouldn't believe it. People just have no idea. So let's move on from this. And perhaps you could show a graph or two of the things we talked about when you look this over later. I wanted to look at this in the context of herd immunity, which I'll get to in a second. But here are the Scandinavian countries with new deaths down to 0. France has a little bit of a bleep there. And we can talk about second waves, which I actually don't believe in. There is a bump in the fall and winter, but I think it's due to seasonality primarily. I don't believe in second waves because it's antithetical to the Gompertz curve and why it turned and went down. Why would all of a sudden be a bunch of people making up a curve be available to die and get sick when the reason the curve turned down is because the R value went to less than 1 to be technical, but the virus starting to not be able to find as many people to infect, if you will, and eventually succumb to the disease. So the curve goes down to 0. Do you agree with that logic too?
And just a reminder that I do need support to continue putting together all of this content. And at patreon.com/Ivor Cummins, or for PayPal at tinyurl.com/Ivor Cummins, where you can do a one-off or a monthly support. So I'd really appreciate that, guys, and keep me getting the science out there and countering perhaps the more biased corporate type science. Thank you. Yeah, absolutely. And we predicted this, the seasonality, we were talking about this back in May at the latest, and Hope Simpson's book about influenza transmission. He spent 50 years in England studying this. Incredible book, and I can put the link later. But the reality is, I always say the Gompertz is very simply a few key things. Passing of the susceptible, sadly. The development of community immunity from this novel virus builds rapidly with T-cell mucosal and, antibody in many cases. And then you've got the seasonality, that the season shifts, human immunity rises. So it's another big factor. But they're the three big factors. And then there's some more as well, of course. But they're the big ones for the curve. And then in the summer, with all three of those, you get a fall. But what happens when the winter comes? Well, seasonality now goes the other way and the coronaviruses rise. Okay. Also, you got another 6 months of people who've moved to stage 4 cancer, people who've become aged and infirm, very aged and infirm. So you have 6 months more build up of susceptible. So coming into the winter, you are going to see some mortality too, sadly. But the reality is, you're never going to be like the first curve for mortality. It's like all influenzas. You can't be a new virus twice. You can't be a new virus hitting a population twice. You can only do it once. So we're going to see a rise in the countries that had more exposure. It'll be a lower rise, but there will be a rise in the winter. But the $1,000,000 question, this is the only metric that matters. Will the winter of 2021 coming be higher in all-cause mortality excess than prior sample winters? Or will it be largely now back to the same as prior respiratory season winters? And it has always been the case that the winter following a new virus introduction is pretty much back to the endemic. We may see SARS-CoV-2 being mostly found on the people who pass because it looks like the influenzas have basically kind of dropped off the map. And we've seen this before in the 60s, an influenza strain that was there for 60 years. A new strain came in, and this is documented, and the old one that was there disappeared, and it has never been seen since. So the fact is, SARS-CoV-2 is going to be badged on mortality this winter with a hysteria. But what will the excess overall mortality be? And I would say it's going to be like prior respiratory seasons.
I agree. Time will tell, and I can't wait for the data to come out. That's a very good point you made about 6 more months of people becoming susceptible, if you will, or more susceptible that might have escaped it the first time. It's not a second wave. The population has changed. And those people, to you and I, 6 months, well, I'm a lot older than you, but 6 months doesn't mean a real lot to me, but to someone who's 85 years old, it does, as far as their health goes. It could be half of the rest of their life. They could go from playing golf to kind of almost being bedridden just because their body is falling apart. And that's the type of person that would be more susceptible 6 months after the initial peak. That's a very good point you made there. Let me just talk quickly about the medical consequences of lockdowns, because so far we've just said that they don't work. Let me just read a few things here. In the United States, 650,000 people are undergoing chemotherapy at any given time. Half have stopped their treatment. They're afraid to go to the hospital to catch COVID. You understand? 2/3 to 3/4 of cancer screenings were not done this year. That includes things like colonoscopies. People just skip them. 40 to 50% of people with heart attacks did not even call an ambulance because they were afraid to go to the hospital. There's all kinds of statistics. I'm studying heart surgery now, so there's all kinds of statistics about getting TPA and everything in you quickly. And if they don't if they don't call an ambulance, they're much more likely to succumb from their heart attack. More than half of US children did not go in for their vaccinations. It's unbelievable. Deaths of despair. People lose their jobs. They commit suicide. They lose their life savings and commit suicide. There are more opioid deaths, which is a big problem in the United States. Alcohol-related deaths go up. ER visits for child abuse are up 35%. And this is serious child abuse, such as spiral fractures and problems where the child is really having a hard time. Small child abuse, parents don't take their children to the hospital unless they're really worried about them. So serious child abuse is up 35%. Non-emergency surgery was discontinued during the lockdown. That means that suspicious issues that a surgeon would have normally done an exploratory lap for, or a hip or a joint replacement, etc., were postponed. Herniated discs and other painful things cause an increase in opioid abuse. There's so many factors that come out of locking down healthy people. Let me move on now, but you can tell there's an enormous amount of medical consequences from this.
I just add there, Reid, that before you go into economic, which will also cause enormous suffering and death in its own right, but the other thing is that all of these deaths that are built up to occur over the next 6 to 12 months are going to contribute to excess mortality this winter. But because SARS-CoV-2 is endemic and it will rise like coronaviruses always do in the winter, they're going to get to badge a load of excess death with SARS-CoV-2 inappropriately. So they're almost falsely proving their own hype and modeling in a small sense. So it's just truly anti-scientific in a profound manner what's coming. And the other thing is there's 2 published papers now with modeling, but very well executed complex modeling, indicating that independent of all these effects of lockdown driving mortality, lockdown will actually drive more COVID-19 mortality in the long run, because the aged are the profile most affected in mortality terms. By not allowing the younger healthy to gain more immunity, in the next season, when you add everything up together and aggregate it, you'll end up with more total mortality from COVID by having prevented herd immunity if you achieve that aim. So there'll be more mortality from COVID due to lockdowns, and there'll be a huge amount more mortality from the lockdowns that are non-COVID that you're describing. So it's an act of incredible vandalism, I would say. Vandalism and ransacking your society for no real benefit. It offends me as a person deeply, because like you, I've worked for 8 years on saving lives from heart disease. I've been involved in the calcium scan promotion to save lives. 8 years working to save lives. And this year I have to watch this horror unfolding.
Absolutely, Ivor. I just want to make a list of some of the economic consequences from the lockdowns. 265 million people worldwide are facing acute food shortages. That's from the World Food Program, October 10th. 100 million additional people have fallen into the extreme poverty category, living on less than $1 a day, World Bank. The WHO estimates that 140 million people will starve to death because of the economic fallout from the lockdowns. Isn't that amazing? In the US alone, 11 million people still do not have their jobs back. So they have loss of income, loss of life savings, evictions, etc. 100,000 businesses have closed permanently as of September 16th, and the number continues to increase. So there's just tremendous fallout from the lockdowns.
Yeah, it's a disaster of epic proportions. And sadly, we know from all the published papers, the lockdowns deliver very little benefit in mortality savings. So the cost benefit is extraordinarily negative. I'd say the worst in history for a public health intervention.
Absolutely, yeah, the worst in history, no doubt about it. So I started thinking about why the lockdowns didn't work. Not just that they didn't work based on the data, but why. The only lockdown experience we've had that I know about is lockdowns of prisons when there's a riot, and everyone knows about that, to quell the riot, and lockdowns of schools, possibly when there's an active shooter, like there is in the United States sometimes. But we hadn't had an experience locking down for a viral pandemic, as far as I know of, until this year. Is that correct?
I'd say so. There's various stories of 1918 flu, which was probably around 50 times worse than this. And it's very mixed. Many publications saying lockdown and trying to isolate didn't help. Some people claiming that it was probably associational, that it did. And even the cities where it did, they tended to get things a bit worse later on. So the whole thing was a mess. And that's why 40 years of published science and a big paper in 2006, and the WHO guidelines 2019 and the Irish pandemic guidelines all universally said no lockdowns and quarantines once a virus is effectively around got in the population.
Wow. I don't know if you've read this story or not, or this paper really, National Institutes of Health, but in 1960, some explorers wanted to spend the winter in Antarctica. And of course, before they left, there were 12 of them. Before they left, they all had extensive history and physical and laboratory investigation for any infectious disease. And for 17 weeks, no problems at all with any of the 12 explorers. And then one guy started getting really bad symptoms of a cold. And within a very short time, 6 of the 12 men had a cold, a bad cold. So, I mean, that's 4 months and 1 week in Antarctica, where it's very cold, and thousands of miles from any other human being. And somehow a virus lasted 4 months and 1 week, or it came in on the whim, probably, because 4 months and 1 week is probably too long for an incubation period, certainly. And can they live that long without a host? I don't really know. We'd have to ask a real expert on that, but how did that happen?
Well, that's an interesting one, and I don't usually speak of it because the science is limited, but we have got published papers that show dormancy of actual cold viruses. There's only a few, but long-term dormancy, inactivated virus, and then will tend to surge when vitamin D is low or the immune system is low. There's a triggering, like the seasonal triggering of flu or influenza. And I believe this paper, they didn't fully verify the virus, but they eliminated a lot. And there was some evidence that it was a coronavirus based on cellular work in the laboratory, but it was unclear. So I'd say dormancy is a big question. And you know what, Reid? We said earlier that Brazil had the virus in the human sewage in November 2019, same as Spain. Right? But Spain and Italy exploded in February and Brazil exploded out in April, May, June. So we know it was circulating everywhere back in 19, that far back. So in a sense, we know there's something going on with dormancy and spread and then activation. But no one speaks of that because it takes away from the narrative that right now it's always about stopping spreading it. But I'd say coronavirus this winter in Europe, it's as much possibly a resurgence, right, of virus that's in the population as it is person-to-person spread. So I think a lot of their person-to-person spread is associational. And we can't prove it, but, you know, there's a group of nuns in a closed order, you know, they don't even speak to anyone, and they got an outbreak in that place. And I think they were just being fed their food in Italy. So there's a lot going on here with travel of the virus, in weather systems. There's a published paper a couple of months ago showing that bacteria and viruses can travel in trade winds and drop down in a country. So all of this science we're talking about is never addressed.
You're right. Yeah. It's important to know, though.
Yeah.
So anyway, as I continued my thinking about the story I just told you, I think part of the problem here is that you can't really solve a nanoscopic problem with a macroscopic solution. The virus is so small, it literally pervades every crack in the house. If you took a family, for example, where the father said, okay, we're not going to leave the house. I don't want anyone in the family to get sick. We're not even going to go shopping. We're going to order out for all of our food. You can imagine a 19-year-old guy who works at night as a delivery boy for a pizza company who's a college kid and he's got it. And he takes the pizza up to the front porch, rings the doorbell, and then maybe goes 10 meters out into the front yard and waits so that some dog doesn't come up and pull their dinner away, you know, just as a courtesy. And maybe he rings the doorbell twice and he goes up and breathes a bunch of COVID around the porch on a still night. And then the father opens the door and sucks a bunch of the air in. He's wearing gloves. He's very conscientious. So he opens the paper box, the paper bag, and even the box with his gloves, and takes them off, and then grabs the pizza from the inside and takes it in the house. But of course, the pizza boy put the pizza in the box, so he might have put some virus in the pizza and on the surface that the pizza's on. You understand what I mean? You almost can't get away from this stuff. Everybody's going to get it. So
Yeah,
I just wrote
I'd say,
this. Oh, go ahead.
no, I'd say it's all pervasive. I mean, the viruses, every species, including bacteria on Earth, has around 100 associated viruses. We came from them. They are, as you say, ubiquitous and everywhere. And on the opposite side, we see that symptomatic index cases traced back in an Asian study. Most people exposed indoors, no masks, with the person who was symptomatic did not exhibit any effects and even had negative tests. So the reality is, whether you catch it or not and exhibit a problem is more to do with your immune system, prior cross immunity, metabolic health, yada, yada, yada. It's not about stopping the person spreading it because, like you say, it becomes ubiquitous, really.
Exactly. Anyway, I wrote this in nanoscopic viruses eat macroscopic lockdowns for lunch. The same idea.
Yeah.
Now we're on to masks. And let me just say this about, I was kind of disappointed when I studied this extensively and found out that masks don't really work because, I'm hoping that something works. We'd like to know that something works, but I'll tell you, I looked at a lot of stuff on masks and I just can't endorse masks at all. They just don't work. It didn't change the shape of cases versus time or deaths versus time for any country. And they must change that, a la Richard Feynman's quote, if you believe they reduce transmissibility, right? The curves have to change in some way, and they just don't change.
Yeah, Reid. I did a video on this back when they came in mandatory because I could not believe in Europe in the summer at the nadir, which we predicted there would be no ICU or mortality all summer till next winter. And bang in the middle of that, months away from any issue, they brought in mandatory masks with fines. And that was a dark day for me because science died on that day for the nth time this year. And I pulled a load of countries where mask mandates came in at all different points and their R curves. And the R curve didn't slightly shimmer following the mask mandates in any country. And empirical science, the basis is you must observe with your own eyes what happens after an intervention. Empirical, your own eyes, that something happened. And when nothing happens anywhere, you cannot but acknowledge that what you did had no real effect. And all of the 40 years of science on masks broadly said that, including randomized control trials, mind you, as well as associations. But they threw it all away for a few associational weak studies in June 2020, turned the whole of science upside down, and has ever since.
I heard was there a study in Denmark or something that I couldn't find it anywhere. Was it never published or something like that, or wasn't good enough to be published?
That's another scandal. So Denmark went ahead to do the only randomized control trial with SARS-CoV-2 and mask use, blinded. Not blinded, but randomized. And they got the results a couple of months ago and everyone was waiting for them. And eventually the lead author was pushed, and he admitted that we can only publish it when we find a journal brave enough to. So all journals refused it. Now, if the trial had showed that masks helped in any way, all journals would have fought each other like dogs and cats to get hold of that paper, but they all did not want it. And the team were asked, well, why don't you preprint it and publish it as a preprint? And basically the lead author admitted that some people on the team were uncomfortable with the findings and they didn't really want it printed. So we know what it said, obviously. But that's censorship of science, of course, which Feynman, again, would be outraged by.
Absolutely. I think that's the last slide in the show, but let me continue on here. countries that use minimal masks did not fare worse than their neighbors. This kind of information is really to the point. When you've got a couple countries that are nearby, one of them doesn't use masks at all, the other one has a mandate, and they don't fare any worse. I mean, what else do you need almost? Due to, go ahead.
Oh, and it's the same with lockdowns, of course. So lockdowns and masks largely have no correlation with the outcome that you're attempting to change, which is stunning. Empirical evidence doesn't really exist for two major implementations which were never backed up by established science in the last 40 years. That is sudden new science, in lockdown's case, copying China, in masks' case, wanting to do them based on a few junk papers. I looked at them, I'd call them junk papers. Everything was thrown out. Our history of science and pandemic management was all thrown out. And empirical science looked on and said, guys, why are you doing this? And there's no answer.
Amazing, huh? At least the masks don't cause the kind of damage that the lockdowns did and will, but maybe not.
Yeah, that's often used as an argument. Oh, why complain about masks because they're easy? Well, there's billions of dollars being spent on them. They are impacting, one person called them child abuse, because if the science doesn't support them, and we have multiple published papers that children in school, especially young children, are not a vector, multiple published papers, and we mandated them for children. So children are going around 8 hours in school wearing masks. They can't speak. They can't hear the teacher properly, right? They're out playing in schoolyards, outdoors, with masks on. If someone says that that's harmless, I say that person's a sociopath, in my mind, if the science doesn't support what's happening. It's an enormous intervention that's unprecedented on the human species to mask everyone, right? You're calling that trivial?
Well, wait a minute. Wow. I was being facetious. Look at the last sentence on my slide. You see it? Masks may be harmful to the
Sorry,
user. Yeah, I know.
I meant the person who genuinely claims irately, masks are easy and why are you against them and we're saving granny. If anything, masks in the summer will limit safe spread in the safe season and limit immunity development. If anything, they might even hurt granny come the winter. If anything. Same with lockdowns.
Yeah, they'll definitely make the hump bigger in the winter. Because
if anything,
that's right. They may not do anything, but there are other reasons other than the very good ones that you listed why the mask may be harmful to the user. I'm just going to talk about that a little bit. But first, you would not believe the people that are advocating for these masks still. The director of the CDC in a video said that he's talking in Congress. He's a witness in Congress, and he said a vaccine that is 70% effective, my mask might be better protection than that. He said that. This is the director of the CDC now. You know, Dr. Francis Collins, he's a giant in, gene sequencing and everything. He said masks prevent the spread of the virus. Can you imagine someone like him saying that? Now, I have another...
We're seeing the narrative again, Reid. I think we're seeing that the narrative must be upheld regardless of any science, any publication, any established science. The narrative has become the imperative. Therefore, everything is drawn in to support the narrative, and anything that conflicts with the narrative is dismissed, rubbished, pilloried. So that's religion, that's ideology. So what we're seeing on lockdown and masks is ideology. And science and Feynman, that's long gone, long gone.
Isn't that just tragic and sad? And I don't know what other adjectives you can use for it. Dr. Fauci in March told our show 60 Minutes, which you've probably seen, that there's no reason for people to be walking around with a mask on. He actually said that on the video, which I've listed there. And then in October, the final quote is Dr. Fauci said on CNN that if people are not wearing masks, then maybe we should be mandating it. Isn't that amazing? He's the guy, you know?
It's amazing. And it went to further high farce where Fauci said people should be wearing goggles also. And this was after the epidemic had waned. So it's clearly an agenda. You can argue about the reason, but it's 100% clearly an agenda to bring in mandatory masks in the middle of the summer in Europe, as I said, when the epidemic was over, for Fauci to do a volte-face, for everyone to drive masks as if they were a complete panacea, right? It's clearly an ideology of sorts. And what can we do about it? I'm not sure, but it's just this whole thing has been an insult to science, the likes of which has never been seen in human history, really.
Yeah, you know, the thing about it is wearing a mask, can you think of any better way to take away a person's identity than covering his face and especially his mouth? You know, there's so many angles on this. And I'll tell you, some of them, I don't want to sound like a conspiracy theorist, which is a bad word these days, but China, there's evidence from a lady who escaped that worked in the lab. You may have read about her or seen her in videos where she said that she gave reasons that the virus did not occur naturally because of the way it was spliced together and so forth. Okay, the genome. And then China put a lockdown in, which you and I know don't work, and publicized it as working really well. Maybe they wanted the whole world to put them in, you know, because they were the first country to put them in. Lasted about a month, a little more in Wuhan, but in the Hubei province, it was shorter than Wuhan. Wuhan, they extended it a little bit, and they said, oh, it's great. Nobody has it now. It's unbelievable. We only closed down for a month. And then all these other countries did it, and what a disaster it created for them. So, you know, there could be some sinister things going on here. I don't know.
Well, yeah, whatever about, I don't get into the creation because it'll never be known. It could be done technologically, so it could have happened and escaped because the technology can do it. But I avoid that one. But I will talk a little on what you said about China. So yeah, they had videos of people dropping dead in the streets. There was a story in the New York Times about tens of thousands of Twitter accounts emanating from China, extolling the virtues of lockdowns and saying Italy needs to lock down, extolling the virtues of locking down, and Italy must lock down. So they definitely drove it, and it was like almost a trick to play on the West. Fine. But if you look closer, millions of people apparently left Wuhan when all that lockdowning started, and they went all over the place, but there was no big epidemic anywhere else, right? And then a while later, they opened up again, and videos came out months ago showing huge water parties in China and Wuhan, and parties, and they're not even wearing masks, a lot of them. So how did a virus that clearly got out and went around the place just then become not a problem virus? And the suggestion is that it was not a huge problem virus, more than a bad flu equivalent in the first place. And we've seen that in all the European data. It's a nasty one. It's very tough on Western obese and diabetic populations, you know, and in the aged, of course. But it's a bad flu equivalent from the actual data now. We know that. And to your point earlier, we knew it from the Diamond Princess. You know, we knew it from the early data.
Once you plug it in, it comes right out. It's tiny. Yeah. You know, if you test everyone in a fixed population, the infection fatality rate is tiny. It's 0.1%.
Around
so there's a lot going on here.
There is. And you know what? I think, though, we've covered, they were excellent slides, and we've covered kind of every important facet of this, I think. I mean, this podcast, largely speaking, covers everything you need to know. And the only thing we didn't really touch on, or perhaps we did, was the long COVID. But I think it's very clear now that influenzas and shingles, there's many viruses that through the immune system activation and the damage they cause to tissue have, in a small proportion of unlucky people, have long-term fatigue and effects. but the percentage is clearly coming out at less than 1% or so for any significant effects 4 months later. And like I always tell people, the only reason we do extraordinary measures like lockdowns that destroy society would be a bubonic plague type where everybody knows someone who died or was badly affected. Rough and tough, every family knows someone. At that level, you may do extraordinary measures. But the problem with coronavirus SARS-CoV-2 is most people don't know anyone who even knows anyone who died outside of a nursing or care home. And so the mortality impact cannot justify the destruction of society we're wreaking. It's vandalism. That's the thing. So don't even begin to bring me to non-mortality metrics. I mean, that's insane to even consider supporting lockdown type implementations based on a small percentage of people who have some longer term morbidity. We have never done that. We never would do that. I mean, is this not obvious?
I know. I can't remember whether I've done the slide already or it's coming up in a minute, but I talked about 2017, 2018. 70 million people got the flu that season. Nobody even hardly knew it was here, and certainly nobody was tested. Like, it's what's happening now. Something really odd is going on with this. Now, again, I don't want to talk politics, but there's an election in America, and some of the people really want to make Trump look bad, like he didn't manage it right or something. So they love to inflate the numbers and so forth. I'll leave it there. But again, some strange things happen. China advertised that lockdown as being the panacea, and then, like you say, everyone's out playing in a water park 3 weeks later, and it really looks like they suckered everybody into doing this terrible thing. And to your point, Wuhan is very close to Shanghai, and of course, when you find out there's going to be some draconian lockdown, everyone gets in their cars and zooms to another city. A lot of them went to Shanghai, and Shanghai just had a tiny handful of mortality, like, I don't want to say 9 cases, but it was some ridiculously low number. Same with Beijing, it was very low. And, it doesn't make any sense. Thousands of people would have gone to Shanghai. And also, China, didn't they let a lot of flights go overseas when all this was happening? You know what I mean?
They sure did.
Everything about it was very strange. It's almost like they wanted it to spread everywhere, and then they wanted everyone to go into a lockdown, which would destroy their economy. You know what I mean?
Yeah, no, and if there's anyone you could pick who has blood pouring from their hands, it's Imperial College London, because they based their shock horror non-peer-reviewed report that started this madness in Europe. They based it on 6 infected people out of 690 people total on 6 flights out of Wuhan. It's in the paper. That's kind of the basis for their IFR and assumptions. Yes, 6 infected people.
Or paper or prediction or whatever. Oh my God.
And they were out by a factor of 12, and Professor Levitt in February used 2 other Nobel Prize winners to manage to force getting hold of Ferguson and Imperial and get a reply. And he explained mathematically from China data that their lockdown and their whole assumptions were out by a factor of 10 to 12. And he was precisely correct. And they basically told him to go away and would not review the data. So they were hell-bent on this. That's a reality. And Ferguson is still coming on the television now. And guess what he's saying? The second wave could be worse than the first, which makes 0 sense. And he's still on the television.
I know. How could that be? And the other thing that is shocking to me is that all these other scientists didn't catch it. They're supposed to be reading that paper and going over it with a fine-tooth comb, correct? And seeing that the modeling is so far off, it's going to cause a disaster when it gets accepted by governments, because the politicians don't understand medical science. They're going by the...
Well, yeah, what we saw, and you can argue why it happened, in most countries, a cabal of academics and scientists rose up rapidly through the ranks and became the spokespeople. Sage in England and Neffet in Ireland, mostly civil servant types. Same all over the world. It's like the wrong people rose up and embraced the madness. And once they engaged in it and drove it, now they're committed, they're invested, and they hold an iron grip on the narrative and the media. And all the scientists began to wake up because, to be honest, Reid, all the scientists in March couldn't know about Professor Levitt, and they couldn't know that the modelling was junk. So they kind of thought, well, you know, look at Italy, look at the fridges. So it seemed okay to say, well, let's lock down for a few weeks to flatten the curve. And when a few weeks passed, the curve turned of its own accord, we know now. They didn't want to let go of the lockdown. So you've increasingly seen good scientists try to rise up to get science back into the picture. But the problem now is the media won't feature them. YouTube censor them. Everyone calls them granny murderers. And suddenly the initiative is gone, and the bad guys have the initiative, and by God, they're holding on to it. And that's to this day is what's happening. Yeah.
In all morning, and they're talking about it's going to be worse than before. And these are doctors that come on television that do this. They're kind of shill doctors or something, but it's amazing. How could these doctors not see this when people like you have presented it for them and given it to them on a silver platter? You know, it's hard to figure this stuff out at first. It is, because you're alone and you don't know, but you're not 100% positive. You're 98% positive. But now there's no need to be brilliant about this. You just have to look at the graphs. I mean, it's not that hard.
But now it's entrenched, and there's clearly an enormous agenda. No conspiracy theory, I hasten to add, an agenda that's just simply real and public. The WHO drove the masks when it was utterly anti-scientific. They're not stupid, so why did they do that? The WHO equally knows the science on lockdowns and the analyses, but they remorselessly recently pushed lockdowns again from Tedros all the way across, and they're imploring governments to lock down hard. And they have to know that that's the wrong thing to do. So you can go through the World Economic Forum, WEF. They've made it clear that this is an enormous opportunity to bring in the Great Reset and to retool the world. I'm not even going to say whether they're right or wrong in their ambitions, but they are using Corona and they're openly admitting it. So I think I could go on and on all day, but there's clearly in plain sight huge worldwide organizations who need this crisis and who are fomenting panic for 8 months now. Why they're doing it, you can argue, but the fact that they're doing it is plain and obvious. And I think more people are realizing that now because, like you say, the data is screaming at us now. You don't need to be kind of really smart and a problem solver. This stage it's in your face, but cognitive dissonance is enormous now. After propagandizing the public and everyone for 8 months, the media, the politicians, these academics, the bad guys, everyone now is caught up in the narrative. And to try and pull people out of that, their brain will resist common sense now. You know, this cognitive dissonance psychological thing, it can be enormously forceful.
Right. But they won't let someone like you or me come on to, let's say, a liberal channel and explain it to them. They won't engage in the debate. I'm interested in the climate change debate too. And the people that are sort of on looking at it the way I look at it can't get the other side to debate them in any public forum at all. They just won't come. They say the science is settled, all these really odd things like the science is settled. I mean, have you heard that before? Oh. So there's a lot of strange things going on, but you don't think China kind of deviously wanted to see the economic life of all these other countries get damaged so they could move up in the world or anything like that? Because it sure looks like they did a faux lockdown to me as far as the result of it. I don't know.
To be honest, Reid, I always answer this question. There's no single evil genius stroking a cat, you know, under a mountain in an enormous compound. But the reality is there's no conspiracy theory. So I'd say it's all of what we mentioned. China certainly exploited a new nasty virus and saw it was an opportunity to send the fat, lazy, soft Westerners into a tailspin. Why not? The WEF has been very clear on its goals and it's remorseless in driving them. The WHO, the UN, the European vaccine alliances, have plans for vaccine passports by 2021, and they were published a year or two ago. I mean, imagine you wanted vaccine and health passports by 2021, and then Corona came along. Can you imagine how you'd feel? You would salivate. You would see an enormous opportunity to move forward decade-long plans and get them done in 6 months. There's no conspiracy theory. It's just unfortunate that a vast array of very powerful bodies all pretty much see enormous opportunity in SARS-CoV-2. And then they all probably, to greater or lesser extents, they talk to each other and communicate. So it's like everyone's got the big payday now. And I think what we see is the result of what I just described, this huge, remorseless, general push towards hysteria, because it will enable everyone's goals. And the whole of the pharmaceutical industry is salivating. Like, it's just one of those phenomena that unfortunately has been exploited beyond belief, and no conspiracy. And just a reminder that I do need support to continue putting together all of this content. And at patreon.com/Ivor Cummins, or for PayPal at tinyurl.com/Ivor Cummins, where you can do a one-off or a monthly support. So I'd really appreciate that, guys, and keep me getting the science out there and countering perhaps the more biased corporate type science. Thank you.